Good morning, everyone. The title of my paper is Intraoperative Cytology of Gallbladder Lesions in a Tertiary Healthcare Center in Barabanki. Gallbladder carcinoma has been known to be detected incidentally during or after cholecystectomy in case of polylithiasis. Intraoperative cytology is a quick and effective diagnostic technique in detecting malignancy and also when tumor invasion is suspected but not confirmed via imaging. Smear cytology provides rapid results and can be used to confirm malignancy intraoperatively, especially in regions with high gallbladder cancer incidence. The study aims to determine the utility of intraoperative cytology in the diagnosis of gallbladder cancers and to classify the lesions according to cytological diagnosis and correlate it with the final histopathological diagnosis. The sample size was 100 cases taken in Department of Pathology, Hind, Barabanki. Prospective observational study was done for 18 months and all consecutive cases of resection and biopsy were included. Methodology included clinical evaluation and diagnostic evaluation. Diagnostic evaluation comprised of gross morphology of the specimen, cytomorphological diagnosis of both imprint and scrape, and then compared with the histopathological evaluation. This is the intraoperative cytology technique, the necessary instruments required for cytology, technique done for making the smears, and finally the slides obtained. Cytological diagnosis of both imprint and scrape smears was done separately, as well combined cytological diagnosis was compared with the histopathological diagnosis. Stats was done, sensitivity, specificity, positive predictive and negative predictive value were calculated. Majority of the population was of females and age of the patients ranged from 23 to 77 years. Age of the patients having malignancy ranged from 45 to 77 years, and therefore there was a significant difference in the age profile of patients having malignancy. Histopathologically, a total of 11 cases out of 100 were identified as malignant. 5 were of adenocarcinoma NOS, 2 were of intestinal type, 2 adenocarcinoma biliary type, 1 of mucinous type, and 1 case of dysplasia. 4 were well differentiated, where remaining 7 were moderately differentiated. This table shows the diagnostic efficacy of cytology. 9 cases were diagnosed as malignant in cytology, and therefore the accuracy was obtained as 98%. On gross examination, significantly higher wall thickness was seen in malignant cases in gallbladder. The first case is of chronic cholecystitis, and it represents the scrape and imprint smears. Scrape smear shows clusters of monomorphic cells, and this imprint shows focal mastic appearance of the columnar cells. The second case is of chronic cholecystitis with cholesterosis. On scrape, it shows foamy macrophages, while the same case in the histopathology shows foamy macrophages in the lamina propria. The third case is of low-grade dysplasia in the gallbladder. Scrape smear shows increased cellularity and mild cellular overlapping, while the same case in the histopathology shows epithelial stratification, mild nuclear pleomorphism, and hyperchromasia. The fourth case is of invasive adenocarcinoma. Here the cytology, it shows high cellularity of tumor cells, increased NC ratio, and nuclear pleomorphism. The same case in the histopathology shows tumor cells arranged in glands, invading the muscle layer, and intraluminal necrosis can be seen. The fifth case was mucinous adenocarcinoma, and in cytology, it shows tumor cells of adenocarcinoma in mucinous background in both the cases. The same case in the histopathology shows tumor cells floating in mucil stroma, and the tumor cells shows abundant pale mucinous cytoplasm and pleomorphism. The sixth case of adenocarcinoma biliary type, and the cytology shows high cellularity clustering, and the insert shows cohesive pleomorphic cells. The B picture shows attempted tubules and gland formation. This is the same case of biliary adenocarcinoma, and the histopathology shows a tumor arranged in glands invading the muscle layer and a high-grade dysplasia and epithelial stratification. The main imprint and scrape smear, it shows cellularity was somewhat low in imprint, and the background was primarily blood and few inflammatory cells. Therefore, the corrective cytological diagnosis was low in imprint, while by scrape it was 100%. In the same, in malignant cases, imprint was satisfactory, while scrape shows very high cellularity. Discussion: the intraoperative distinction between benign and malignant lesions remains challenging, particularly when preoperative imaging or clinical findings are equivocal. The utility of intraoperative cytology lies in its high specificity in detecting malignancy, which ensures that positive results reliably correlate with the true disease, minimizing the risk of overtreatment. The limitation of the study was due to lack of tissue architecture, as we see in biopsy. So specific typing and invasion could not be picked up. Cytology is extremely useful, especially in cases of suspicious gallbladder lesions, where FFT or frozen examination cannot be done. These are my references. Thank you.